Hello, my people. It's Naija Health Doctor. Welcome to my podcast. On today's episode, we'll be discussing about how to have a very nice health. How can we maintain our health? What are things we can do to have a very sound health? Here with me, I have a lab scientist. He will give us an insight on how to maintain our health. Welcome, sir.
Thank you very much. Raiwola Timothy Oluwatobi, a medical laboratory scientist.
What inspired you to be a lab scientist?
If you are the type that love to know the basics or background of something, you will love that profession because we are the bedrock of modern medicine. You work behind the scene, which nobody knows, and that's what makes me love the profession.
What are some challenges you've encountered?
Different patients with their different issues. God has really helped us in medical profession. As one patient is bringing his or her own, God will be giving you the solution. Like a patient that has been sick for whether 1 week, 2 weeks now, just run to the facility. I've been feeling headache since yesterday. Since of 2 weeks. That's a problem on the soul. Because when you want to diagnose, you diagnose based on that yesterday, instead of you to diagnose based on the 2 weeks. Another thing is when you attend to patients, finish, they just meet their relative, and their relative is just telling them to take these herbs and the like. They say, I've went to that place, I'll do this, I'll do that. And at the end of the day, whether the relative just said, you don't need all these things, you don't need that. But they follow the local way, which they just decided to choose. That's another challenge on the soul. When they are not feeling fine again, they will now come back to you. Hey, I did the test that time. Hey, the drug you asked me to take. They did not take that drug. They go and take the local remedy. When you now ask them to repeat the test, they will say, should they have done it that time? Some results are just valid for 1 week or 2 weeks.
I want to ask another question. Like, how can we manage stress?
There are many ways we can manage stress. Everybody know his or her status, and your health status should be very, very paramount to you. You know you are the type of person that you cannot work for long period of time. So you should know that after little work, just take a rest. Even if it's 1 minute, if it's 5 minutes, and you can now resume. You cannot compare yourself to somebody that can work throughout the day. Like me now, I know myself, I cannot walk inside the rain. But we have some people, it is that time that they have their strength, they have their energy to work. So you need to study yourself.
I love that answer. We're talking about rest. Like, how important is sleep to human?
God that created us, he said there is a time for the day, there is a time for the noon, and there is a time for the night. So that night that God has already ordained for us to sleep, we need to maintain it. That specific time that we need to rest, we're supposed to take the rest. Sleeping for just 2 hours, your system will be on. Even all our gadgets that we are using in our homes, you cannot on them for the whole 24 hours, and they will not break down on time. So likewise, the same thing applicable to you, human.
Accuracy of results. Because there are instances where you go to different labs and the result is not the same. What can we say about that? Is it the machine or just put more light to it?
Motto for medical laboratory is precision and accuracy. If you have correct diagnosis, there is no how you have different results. I'm so certain of that. For a patient, if your result is going to be high, it's going to be high. If your result is going to be low, it's going to be low. And if your result is going to be normal, it's going to be normal. I'm so certain of that as a medical laboratory scientist. Let us just look sugar, glucose, for an instance. Reference value for fasting now is within 70 to 100. So as a patient, you went for a test. You have been told that you need to fast for 8 hours. Whether you stop eating by 8 p.m. at night and you are now going for the test the other day, so by the time you are coming for it this morning, it was around 7 a.m. The other time you went for the test is around 9. The hours that you went for the test is kind of different.
Yeah.
So by the time they will be giving you the results, whether the first one they gave you it was around 75 and the second one they now gave you 80, you now said this result is not accurate. The result is accurate because you are still within the normal range and the time that you went for the test is kind of different.
Let's talk more about when can someone decide to go and run a test. Can I just wake up one morning and think of, I just need to go and run a test? Is it possible for me? Or is it annual? Is it every 6 months? Is it every 3 months?
Depends on individuals. There is what we call consultation. Consultation is very, very important. Even if you want to do your annual checkup. Literally in medical profession, we have stages of checkup. You can have annual checkup, you can have quarterly checkup, and you can just have mid-year checkup. Whether you have leave and you just say, okay, when I take my leave, I want to just need to know how my system is. And that is very important.
For everybody.
For everybody. You've decided within yourself that you want to go for checkup when you are on leave. You need to do a normal consultation. Okay, where did I want to use? You have jumbo price, you have bronze, you have silver, you have gold. What are the tests that all this package it contains? And from there, they will be able to tell you that, okay, you want to do lipid, it's going to be fasting. You want to do sugar, it's going to be fasting. And the other ones, you can do it time. Okay, part of your package, there is abdominal scan there. Sure, you get my point. Yes. Now. And for your abdominal scan, you will need to be pressed. So if you don't want to stay long, consultation is very, very important. Even when you are planning for your checkup. Yes. So you can do your checkup whether annually, quarterly, or mid-year.
Another thing I want to ask is this, like men out there, we want to ask if there are certain age we can go for prostate test for us to know if the prostate gland is still nice or is not nice. Share more light of which test are we going for. Okay. You understand?
Yes. Prostate is very, very important. Immediately you see you are 40 years old, there is no how you will say you want to go for any medical checkup. By the age of 40, they will ask you that, have you done your PSA? And the full meaning of PSA is prostate specific antigen. So that test is very important. It has its own reference value from 0 to 4.0. So if you don't have any value within 0 to 3.5 or within 0 to 4.0, they still know that you are still within the range. And if you don't even have the antigen at all, you just have within 0 to 2.0. When you have PSA, you have prostate, you need to be doing it at least 3 times or 4 times in a year, so that you know the value, if the value is increasing or declining based on the drugs you are using. And the value must not be up to 0.7 that is going to be increasing, if at all, if the drug is working for you. If the drug is not working for you, you will know. And that is the place of the medical doctor.
What are the signs for you to know that my prostate gland is enlarging? What are signs? Because there are methodology out there. So I want us to shed light, like what are things we can see that will give us the insights. Some people, they are above 40 now.
Yes.
And some people are just hearing it now. Like, okay, once you're 40, you need to go out there and run the test.
When you are age of 40, it's not only prostate test you need to do. There are some certain tests you need to do. But I'm coming back to that.
Thank you.
Let me just chip in on the major question you asked me.
Honestly.
Difficulties in urination, you will find it. Even your abdomen will be having some difficulties there. Some people, their PSA always come with infection as well. When they urinate, we say their urination is somehow colorish and the likes. When you have seen some things that is different in your system, you don't need to wait until you have the blockage that you cannot even urinate at all again. Something changed in your system, you need to run to the healthcare provider to know what is really wrong with you.
People with high blood pressure. Lately, we understand that people are scared to run tests. Some people will tell you that when I run tests like this, hey, they want to kill me, oh, I don't want to check my BP, oh, I don't want to hear anything about sugar, oh, I don't want to hear anything.
Can we help people to understand that we need to go out there and check this thing?
Some facility have made their health provider trust that this thing will do it for free of charge for people. And that is the way many health facilities are helping people now. You said you don't want to do it. Is it until it want to kill you or until the time that they now tell you that this thing you need to be taking drugs? This BP issue is a very simple thing. When you observe that it's slightly high, they will ask you to rest. It's not immediately they will ask you to be taking drugs. There are some questions they will ask you. And when they ask you all these questions, it's what is going to help the doctor to tell you that you have the history of BP. Even though if you don't have the history of BP, you yourself personally, you have BP with this. So it's very important. It's not until you see that your heartbeat is rushing fast, or until you see you are having headache, constant headache,
Or you're panting.
or you are panting. It's not until that time. You can just see them, they have medical outreach here. They say there is free body pressure test, so there is free test. So do it. Just make yourself available. And from there, you will know what is hidden in your system. As you are talking to me now, you don't know if I have it. It's only when you do the test from you now, chairman, you need to be taking care of yourself. And even at this stage, you don't need drugs. You need to rest. It's going to help us a lot. Not until our system begins to damage and they now need to admit us and they need to control it. No.
That is when you will spend more.
You
will even waste your time.
Exactly. The money you now want to make, you will not be able to make the money. That one that you've already made, you will now give it out to we, the we scientists and the doctor. You now want us to chop.
Yeah, it's better when you notice it earlier and tackle it.
Exactly.
Let's put one mouth and talk about diabetes, sugar.
Did lifestyle have anything to do with your sugar, or is it hereditary? I just want us to put more light.
Diabetic is hereditary. Yes, you can inherit it from your family, but not that because your grandmother have it or your mommy have it. That doesn't give you positive thing that you need to have it. It's not a must you can have it. You cannot. Or let me say you may. Don't let me say you cannot. Let me say you may not. Because now they will say that's why I say I cannot. No, you may not. And what may not makes you to have it is when you monitor your lifestyle, you take care of yourself, and you monitor what you are taking. You know, in the olden days, all these our grandpas, they take all this alcohol, but when they have diabetes, they don't even diagnose it as diabetes that time. They just said they are urinating. My urine cannot drip the ground. That's what they know in that olden days. But it is this our English states now that you have diabetes. If you monitor it, you know some people they will take alcohol without good food in their stomach, and in their lineage they used to have diabetes. So there is no how you will not have it like that, because there are some things you consume that you don't supposed to consume. We have stages of diabetes. We have some diabetes that they are induced, certain things that cause it, whether when you are pregnant pregnant can induce diabetes, and at the end of the pregnancy
you will be fine.
You will be fine. That one is normal. But we have impaired diabetes, and we have diabetic that we call it acute or chronic, depend on the stage. By the time you are doing your fasting and it's giving you 150, your fasting is giving you 300. those values are kindly different, and that is from impaired to acute. It is better that you should be diagnosed earlier. Assuming now whether your fasting is 105, we ask you to do 2 hours postprandial. So it is that 2 hours postprandial that is now going to make us to know that you are already confirmed that you have diabetes, because it's a 2 test on its own. First of all, do the fasting, and later on we do the other one. So we need to see the way that your glucose is regulating. If your glucose is not being regulated, it's another thing on its own, and that is what makes us to have the 2 types of diabetes we have. We have diabetes mellitus and diabetes insipidus.
Well, I like the fact that you were bringing it down for people. Let's talk about women. We've talked about prostate gland. Is there anything that can cause early menopause?
In the olden days, our parents will let you know that once you start your period earlier, they believe that your menopause will be earlier as well. For these days, it doesn't. Our lifestyle is very important. In the olden days, you see 50 years old, 60 years old, still menstruating, LD.
Yeah.
But these days, it's when they will tell you that my period is fluctuating at the age of 40 years old because of what you take. But there are some ways we can help ourselves.
To regulate it.
Yes, that you need to do your hormonal assay. If you do your hormonal assay, it's going to help you to know that my progesterone is okay, my LH is okay. We have 5 parameters under the female hormonal assay that can make us to know that you are close to your menopause, you are on your menopause already. Let me just mention the 5 parameters.
Thank you.
We have LH. I will not be saying the full,
Yes,
so that's for my doctors. We have the LH, we have the FSH, we have the prolactin, we have the progesterone, and we have the estrogen.
For people coming behind you, lab scientists coming behind you, what advice you can give to them? Like, this profession is sweet, or this profession is not sweet. Let's hear from you, sir.
Medical profession is sweet only when you know what you are doing. And you should not be biased. If you are not biased about what you are doing as a medical personnel, people will keep recommending you. But if you are the type of person that you don't have precision on your own, how will you have accuracy? It is precision before the accuracy. So if you are the type of person that does not have the precision, you cannot be accurate. And once you don't have precision, you cannot enjoy the profession, because people will rubbish you. There are some people that they are better than me in the profession, but because I will always take my time, I will take my standard, this is what I've done, and I will ensure the precision.
You will help us to advise people about their lifestyle, eating, and the time they should eat their food. These are things that can help us, because the journey is to have good health. That is why we try to set up something like this so people can have the insight on their health. It's your property.
Yes.
That's the only property they have. Your body. You have 5 houses, different cars. They are not yours.
Exactly.
The only property you have is this, your body. Because if I pinch you now, you will know the effect of pinching. If anybody is touching your house where your house is now, you will not know. So I want you to advise our viewers so they can know the effect of taking care of their health.
You don't need to be in a hurry. You build a house, you now get a security personnel to work for you, to be checking on the house for you. It's because you are in a hurry. A day is coming that you will even be the one to be the security of your house. Because when they bury you outside there at the tender age, you need to take care of your house like that. So this your health should be very paramount to you, because when you take good care of your health, you will live long. And what are the things you need to do to make you to live long? Check your BP often, do your sugar all the time, go for your medical checkup all the time. All these our medical personnel, we are always friendly. It's not until you have money that you need to visit the hospital. It's not until you fall sick that you need to visit the hospital.
Yeah.
Enter the hospital. Nurse, help me to do my BP. I want to see doctor. Doctor, I don't have money. I want to do my sugar. The doctor cannot even send you out that you should be going. Because we too, we are human beings and we don't want problem for ourselves in the nearest future.
Some people are even scared to draw close to any clinic. When they hear clinic, hospital, they don't want to enter.
But they don't need it. Because we are their friend, they don't want to see police. But you walk on the streets and you meet the police on the road. Police is your friend. We too, we are their friends. Yeah. Because at the end of the day, they will need to come to us. And it is that time they will not be telling doctor, I don't want to die. Do everything for me, I don't want to die. But there was a time we too, we are begging them, come for this checkup. Everything is not money.
Yeah,
your health is your wealth. Please come for checkup. Do your annual checkup. It's very important. It's not about money. Just working.
And that is another thing we can do to help even government.
Exactly.
Government, they are trying, but we have our own parts to do. Just one or two. And we thank God that we have different organizations that are setting up these days.
Yes.
Yeah, they're doing medical outreach and the rest. It's everywhere now. But the problem is this: some people will even set the outreach. A lot of people will not come.
You see all these couples, they go for medical outreach in the market. You will see they say, "Don't choke me, oh." There is one woman that even said, it is when I do all these things that I will know I will have problem. Because you know you are nursing something in your system. And why don't you take care of it early? The earlier, the best.
Thank you very much for our time. We really appreciate you because we understand that you're very busy. But because of our people, you create the time. You tried. I wasn't even expecting you.
It's good to pray for you not to pray. So it's good as we already take my time to explain this
for our people.
We have primary health center, we have the state owned, we have the federal owned, we have the private. Just walk to anyone. And with that, you will enjoy your life. That work you work for, try to wait and eat the fruit of your labor. Don't allow another person to sit on your children's wedding day.
Always remember, on this show, I always tell you that there are times you need to be selfish for your happiness. Selfish. Take care of yourself. Take good care of yourself. That's the only property you have. The owner of this world give us life to come and enjoy. Enjoy it and eat healthy food. Thank you very much. And we appreciate Renova Diagnostic Center. They are the ones that give us their scientists to come and advise people, give people insight on how to live an healthy life. See you another time. Subscribe to our YouTube channel, Facebook, Instagram, and TikTok. See you another time. Thank you.